Welcome to Celebrate Michigan. I'm Matt Beiser.
And I'm Christy Derry. Did you know that since ancient times, people have devised paste for cleaning teeth and freshening breath?
Well, unfortunately, early toothpaste often included substances that eroded tooth enamel, such as ground nut husk shells, grit, and talc. Sounds pretty gross.
Yeah, unfortunately. And dentistry has obviously come a long way since then, and today joining us is a master of dentistry.
He's an assistant adjunct professor at the University of Detroit Mercy School of Dentistry, and he is a fellow of the American Academy of Implant Dentistry and has received mastership in the Academy of General Dentistry. He has published over 48 articles on the surgical prosthetic phases of implant dentistry. Please give a warm welcome to Dr. Timothy Kosinski. So great to have you here.
Matt, how are you?
Thank you for joining us.
Christy, thank you.
So how long have you been practicing?
25 years, believe it or not.
Wow.
So it is safe to say that you are a master at this point.
I've worked really hard at it. We've gotten pretty good. That's why they call it practice.
The master aura, yes.
Now, you also brought with you today a mouth guard and another device.
Well, Christy, I think it's real important with hockey season. We're in the middle of the hockey season. We're all excited about what's going on with our teams. And I think it's real important that, that our parents out there, for young adults and our younger kids, that they make mouth guards. Professionally made mouth guards are better than the ones that you can buy at the store. They fit correctly. If I can just pop it in real quick.
Wow.
And it protects, I'll take it out so I can talk. So it protects the top teeth. Those are the teeth that are protruding most, and it's very easy to get an elbow or a puck or falling down and really damaging young teeth, which can affect your life forever. So it's important that our parents understand that they should see their dentist and have a mouth guard made. Most of the dentists out there will be happy to provide this. It's kind of a fun thing and fun colors for their sports teams.
So a better fitting mouth guard will protect you much more than one you can just buy anywhere.
It's very important that it fit well because it protects for the shock effect of it, but also the athlete can breathe better. If it's bulky and big, they're probably not going to wear it. They'll end up chewing it, and it's not in their mouth.
They look
protecting
sillier
their teeth.
too.
Yeah.
Now, I have this clicky jaw, and I was wondering, would the mouth guard also help for that, though?
Well, we make a different kind of mouth guard for somebody that has joint problems. The temporomandibular joint, TMJ, is a term that people have heard before, is a ball and socket. It's like a knee joint, and it can become displaced. And when you hear a noise, that's bone rubbing on bone. That's a bad thing. So what your dentist will do is make you a mouth guard that you'll wear at night, or if you have a lot of headaches and things like that, it will really relieve a lot of those symptoms.
Okay.
I see you have another very, very fancy gizmo down there.
Well, this is really incredible. This is called a diode laser, and if you can see how small it is, it's not room size, and it's a dental laser. And it's not exactly a Star Wars laser.
Oh, I was just going to ask.
We're not going to cut any limbs off with it, but it allows us to periodontally or clean the gums, clean the bacteria in people's mouths. But what's also very exciting about this is whitening of teeth. That's really popular today. A lot of dentists are promoting whitening of teeth. That usually takes an hour or 2 hours in the office, or you can buy the white strips and things like that you can do over the counter. That work well, but it takes a long time. We can actually whiten an entire mouth in about 6 minutes with this piece of equipment.
Wow.
So really, really effective with almost no sensitivity. I hate to say, I never like to say never, but very little to no sensitivity. So real exciting technology. You asked me how long I've been doing dentistry in 25 years. I've seen more dramatic changes, more technological changes in the last 2 years than my entire career. Dentistry is going so fast and it's so exciting. So those in the audience who haven't been to a dentist in a while, it's changed a lot.
Wow. So that device can bring the procedure down to 6 minutes, makes everything easier. Does that mean it's cheaper for patients who come in?
Well, new technology is never cheaper.
Ah, I see.
So because the equipment is very expensive at this point. But time in the chair, the concern of sensitivity of whitening the teeth, it's worth it. It's still not real expensive. I would say in the $400 to $450 range. So it's not.
To get all your teeth whiter?
Exactly.
Wow.
In a very short amount of time.
Is it permanent, or does it go away after a while?
Well, whitening is a funny thing. That's a question that we always get. It is permanent. You're young, I'm older. Your teeth will stain with time, and there's a lot of food and bacteria and stain that goes into the tooth structure. So what the whitening does is it takes that color away from it. So as long as the amount of time that it took to put that stain in, is the amount of time that it'll take to come back. So permanent is a hard word, but a long time, and you can do touch-ups and things like that.
Real quick, somebody told me today that you can often tell the health of somebody by their gums.
Oh.
Is that true?
Incredible. Dentistry is the first line of defense. If the teeth and gums are healthy, the body is healthy. When people have high blood pressure or diabetes or other problems in their health, we can oftentimes see it in the mouth. And I can't tell you how many patients I've said, they've been great for a long time, their oral health has been wonderful, and we'll see problems all of a sudden. I'll immediately refer them to their physician. It's important that they have a full history done in blood work. We'll find things before a physician will ever notice.
Wow. I'm hearing more and more too that flossing is really important. Then I think that ties sort of into the gum things.
Well,
Does that tie into the line of defense?
Matt,
in
I
your
think,
mouth also?
hygiene is very important. You have to keep your teeth. The old saying is, be true to your teeth or they'll be false to you, is real true. You have to brush, you have to clean, you have to floss, you have to get in between your teeth. But again, technology helps. We have electric brushes. We have different equipment that's out there that makes the job that much easier.
Well, that's good.
Terrific.
I just went to the dentist recently, so it was a new experience for me. And instead of, my old dentist used to scrape my teeth, and this one had kind of a water pick as well as the scraping.
Yep.
Does that work just as well?
It works better. The equipment, again, going back to technology, it keeps improving. It doesn't hurt as much, your gums don't bleed as much, your mouth isn't as sore, but your teeth still feel very, very clean and healthy.
Okay, yeah, because I was thinking, well, this doesn't hurt. Does that mean it's actually cleaning?
It's cleaning.
Wonderful.
It's a nice way to treat.
It doesn't hurt and it's good for you.
Yeah. So go to your dentist. It's important to go to your dentist.
Yeah.
All right, very cool. When we come back, we'll talk more with Dr. Kosinski about his implant program. Not only is he a master of dentistry, but also a teacher. We'll be right back.
Stay tuned. Welcome back to Celebrate Michigan. We are talking with Dr. Kosinski, who is reaching out to laid-off workers and others impacted by the recession by offering high-quality dental implant and bone grafting procedures for at least 50% off the regular prices. Tell us a little bit about that. That's incredible.
Well, you know what? We have a lot of problems here in Michigan, and some of us are very blessed, and we're trying to give back to the community a little bit. And I was fortunate a while back to meet a friend in California, Dr. Todd Engel, who developed a teaching program called the Ladera Ranch Implant Institute. And he asked me to become involved and organize a program here in Michigan. And what it is, it's a teaching program where we teach other general dentists, licensed dentists, to do what I do, implant dentistry. You should probably ask me what an implant is. A dental implant is a piece of metal that's made of titanium, and it's surgically embedded in the jawbone, and it simulates the root of a tooth. So it's used for people that are missing teeth, or all their teeth, and we can actually anchor a tooth on top of that implant. But it's a very expensive procedure, and for those people who are selected into our teaching program, we're doing it at a fraction of the cost. So the public is very appreciative of what we're able to do.
So this is the sort of thing that would normally be out of reach because of those costs.
Well, yeah, a dental implant, could range in the $4,000 range, and we're able to do it for $699.
Wow.
So it's an incredible savings for those people that are candidates.
Mm-hmm. And this is a better thing for people than dentures, which are, you take out and they're removable. This is like a real tooth in your mouth.
Matt, if you were missing your tooth, if you lost a tooth because of trauma or a hockey accident, or Krista bopped you one for saying the wrong thing, stepping over her lines.
Might. Who knows?
I think you'd rather have something permanent in your mouth. And what we're able to do for the public today, very precisely and with a high degree of success, is give you back your tooth so that it looks amazing, feels amazing, and get your life back.
Now, I believe we have some B-roll on this topic, so let's take a look at that.
So what we have here is one of our programs. It's done in the office. It's a 3-day program, and we're actually teaching general dentists with a wide variety of experiences how to physically place a dental implant. They get some extensive training. They get to work on models, but then they actually get to place an implant in one of my patients, and that's where we're reaching out to the community. So the community is doing us a favor too. It's not experimental, it's all high quality product. We don't send anything overseas, it's all done right here in Michigan. And it's just a wonderful experience for our patients. We get lots of hugs in our office following these procedures, not only because of the cost savings, because we're really improving the quality of life of people that are missing a tooth. If you can only imagine being without teeth, being without back teeth, it must be a horrible experience. And being able to actually put teeth in people's mouth is just a wonderful, wonderful thing to do.
Absolutely.
Now when kids lose teeth though, like they've already gotten their adult teeth, is this something that you would do for them as well?
No, it's not for children, it's for adult teeth. And people lose their teeth for a number of reasons, neglect or trauma, gum disease. There's a lot of things. Our older population, it was pretty routine in the past to have teeth extracted. It's not the case anymore. We're trying to save teeth. We talked about the laser. We're talking about brushing and flossing earlier. The public understands how important it is to maintain your teeth, and better than ever before.
Terrific. So now those people we saw who were in your class and were able to do a procedure on a patient, those are all trained doctors who want to expand what they're able to do.
Exactly, because dental implants is something that, although it's not new, it's become very popular. You're reading it in magazines, you're seeing it on TV. So the public is asking their dentist, and the dentist wants to provide the service. You love your dentist, you want to stay with your dentist.
Sure.
And so that dentist needs some extra training, and we're reaching out to them to give them that extra training.
So when they finally get that implant, is it just like a tooth? Can you even tell the difference?
You cannot tell the difference. It looks and feels like a tooth.
Awesome.
It's amazing. It's just amazing technology.
What's the difference between this and veneers?
Okay, a veneer is where you have a discolored or malpositioned tooth, and what we do is we reshape a part of the tooth ever so slightly, and we bond or we adhere this little piece of porcelain. It's like a lady's fingernail. And we actually bond it to the tooth so it's permanent, and it's an aesthetic improvement over what they may normally have.
Okay, versus the implant, which is basically
if you were missing a
getting
tooth. If you're missing a tooth.
Okay, so got it.
So if you have someone come in for an implant and they want their teeth back, how do you figure out how to shape those teeth to that particular person's mouth?
Great question, Matt. What we do, we numb the area. We don't even numb the whole jaw anymore. Just the tooth that we're working on.
Yeah.
We remove a little bit of tissue. We don't even use a scalpel anymore, okay? Bone is not innervated. There's no pain receptors in bone. So this procedure does not hurt at all. You're a little sore, but it doesn't hurt. We have a series of drills. We make an opening in the bone, and all our implants today are basically threaded in. They're allowed to heal for a certain amount of time. We put a tooth on.
Fascinating.
Wow.
Very advanced stuff. Well, we're going to take another quick short break here. When we come back, we'll talk more with Dr. Kosinski. And we're going to speak with a patient who has undergone one of these dental implants.
Stay tuned. We'll be right back. Welcome back to Celebrate Michigan. I'm Christy Derry, and we have with us today Dr. Timothy Kosinski, and also joining us is Dr. Christina Joslin, who has undergone a tooth implant herself. So, Dr. Joslin, how did this come about? Why did you need the implant?
Well, I had an infection or an abscess develop underneath one of my front teeth, and I was sent to Dr. Kosinski because my dentist didn't do these type of procedures, and he said that I'd have to get the old crown taken off and the post taken off and have to undergo an implant.
And what was the time frame for that?
Well, because the abscess had not just developed underneath where the old post was, it had also eroded some of the jawbone before I'd actually had pain. So they had to take the crown off, the post off, drain the abscess, and then he had to pack actual synthetic bone type material in there to help grow the area back in through the jaw so they could put the next implant in.
So before you were referred to Dr. Kosinski, was there a period of time where you thought, oh no, I'm going to have to get one of these old procedures and it might not be good for me?
Well, when I first went to my dentist and she sent me to an endodontist, I said, when I had initially injured as a child, they just simply drained it right off the bat and I was pain-free. And they said, no, because we'd have to take the crown off and the post off and you'd be without a tooth. and I'm a physician, and I'd have to go back to the office without a tooth. And I
Oh
said,
my goodness.
well, that's not an option. So they sent me to Dr. Kosinski, and he was able to immediately, after he put the bone in, he sent me back with a tooth basically there, a flapper, but then they put in an implant. Once I grew up a little bit of bone in there, they could put an implant in with a false tooth there, so that it looks just like a real tooth.
Now, how long did that procedure take?
The procedure with the
With
drainage?
the implant and, well, almost the whole thing. How long
Well-
from when you found out until?
Well, after they first drained the abscess and had to put the bone graft in, you had to let it grow in for a little while, and I had a false tooth, but something that none of my patients could tell. In fact, my father thought it was so good, he didn't even see the reason to go back and get the implant. He's like, it looks great. I said, yeah, but it's kind of like having a tooth that you could take in and out. I said, no, Dad, I'm only 38. I don't want to go around with a
You don't
false
want to do
tooth that could come out. So then when I went back to him, in the office it takes literally, usually by the time he numbs it, it takes 15 minutes.
Wow.
And so then they just put the implant in and put the false
Is
tooth
it one
in.
of your front teeth?
Yes, it is. Can't most patients?
No,
It's
I
just-
can't even
It's
tell.
just one tooth in the front.
Yeah.
I don't
One
know
of
which
the-
one it is.
Yeah,
And it's
random.
better than my original crown that I had. So this fake tooth that's in there right now. Yeah.
So she needed bone grafting.
Right.
What is that?
Bone grafting, there's different types, but basically it's a material. We use a synthetic material that's placed into the jaw, and it stimulates your own bone to grow into it. Bone is a living organism. It's constantly being eaten away and rejuvenated. It's alive. And it's a substance that's put into an area where you're missing a tooth, and it grows the bone back over a period of time. Gives us a foundation to place the implant.
So it's similar to skin graft, like skin graftings.
Yeah, for bone though, like
Okay.
a skin graft, but for bone.
I always wondered.
Yeah.
And Dr. Joslin, you had an infection in one of your tooths. So this sort of thing could be useful not only to someone who may not have taken care of their teeth, but this sort of thing could happen anyway. Anybody could have this need for a tooth replacement.
Yeah, yeah. Because I mean, I had a crown, just like you talked about the trauma. I had a crown placed because I had tripped down the stairs when I was young and had broken the root, and they had to do the whole root canal on the crown. But then later on, an abscess developed, just kind of out of the blue. And before I
Yeah.
realized it had taken away most of the bone in that front part of the jaw. So, I mean, it was a very happy ending for me because I really was worried when I spoke to that endodontist for there being a period of time where I wouldn't have a tooth or something that wouldn't look aesthetically pleasing.
And that was the
I
first
could
you
tell.
learned about
Yeah,
these implants.
yeah.
Amazing.
And they said he was great. They said he's the best around. So.
Well, your legacy precedes you.
Well, it's really exciting. Again, going back to exciting technology, being able to use something, numbing just the area. It's not painful afterwards. It
Not
really
at all.
isn't.
In fact, he gave me pain medicine. I never used it. I never filled it on.
and
either
most patients
occasion.
feel that way.
And you could speak afterwards too.
Yep.
Ah,
Yeah, I was
None of
completely
that.
fine. The drive home, it was a little bit numb. I got home, I was completely fine.
wow.
What do you use to numb it? Just that area? Do you use a needle or?
It's a needle, but we use topical. You don't even feel the shots anymore.
No, because you apply the topical gel first, which numbs the
There's
skin.
no reason to
before
be
you put it
afraid
in.
of going to see the dentist anymore.
really good.
It's really, really pain-free dentistry
That's
today.
great. And-
Even a major surgery like a dental implant that you would expect to be very complicated and is not. It's very routine and very simple today.
And you were able to eat that same day then?
Yep,
Right on
able
it?
to eat.
Amazing.
Yeah, they said, stick with soft foods, but I just kind of ate my regular food in the back seat. Hate to tell you. But no, I
doctor,
did
there
just
you go.
fine.
A
That's
doctor
right. We don't
listening to us.
follow any rules.
And so you are a doctor. What did you think when you learned about this procedure? Was that particularly exciting to you?
It
Not
was
just
very
for
exciting.
personal reasons, but as from a viewpoint of a doctor.
Yeah, because in medical school we learn, obviously a lot about a lot of other body systems, but not dentistry. I mean, I'm limited to like my knowledge of, if it looks like an infection or how many teeth you may have in your mouth at each stage of your life. That's about it. So, and he gave out a booklet on what the procedure all entailed, so it was very informative that way, and I really learned a lot from his booklet. And it does, obviously it is a surgical procedure, so it looks like it would be uncomfortable, but really, I mean, once the numbing procedure happened, I was fine after that.
Incredible.
So once these dentists go to your school or the school and they learn how to do this, can they now perform it in their own offices?
I would hope that they do. We are mentors, and what that means is that we're always there when they need us. We teach them their limitations. We don't expect them to do very complicated cases until they become more confident and more competent in their abilities. But absolutely, positively, when they leave our program, we want them to be treating their patients.
So will they come back to you for more training when they need to do those more complex
We have other phases, more complicated cases that we like them to come and visit us and learn. The more education you get, in dentistry and medicine, the better you are, and your patients want to stay with you.
Now, is there a sort of certification that they get that maybe a patient could look out for to make sure that before their dentist says, I can do this, to make sure that they really are qualified?
That's a great question, and the answer is really no. There's a lot of organizations. Implant dentistry is not a specialty. There's a lot of different specialists that do implant dentistry: general dentists, oral surgeons, periodontists, endodontists, prosthodontists. There's a lot of specialties in dentistry like there are in medicine, and so there's a lot of quality people. The best thing to do is ask family and friends about their dentist. Check the internet. There's a lot of good information out there. And have multiple consultations with different dentists until you find somebody that you're comfortable with. I think it's important that the dentists show their own work. I would ask them to show cases that they've done. Mm-hmm. I think that's very, very helpful to find somebody that you feel comfortable with. So but that's true in medicine too. You should see who's the best at what they're doing.
Yeah, I really think the word of mouth really is how most, at least in the medical world, how things spread is by word of mouth from other patients, other physicians.
Good thing to do. Take care of yourself. Right?
Absolutely. Mm-hmm.
So how do you know when your dentist might be a little behind the times?
Boy, that's not a fair question to ask me. I think
because people have to watch out.
Again, I think you need to look at their office. You need to look at technology. You need to ask questions. You know, you talk to your family and friends. There's most dentists are very well trained and very capable and very caring people. Mm-hmm. So you have to look around and you have to ask.
Now, my dentist for the first time had measured my gums with numbers. And I had never had that before.
Do you know why that is, Krista? It's because you're getting older. No, they're measuring the health of your gums. And we have to find a baseline to start with, and then we'll know if things get worse as time goes by. Okay. So that's very important that your hygienist does that.
Yeah, it was comforting.
Yeah.
There's a big poster up there telling me
how
numbers, what good numbers are and what bad numbers are.
Exactly.
Okay.
So while we're on that, what kind of, first of all, hoping you can leave us with some good messages here. How often should you see your dentist, and what should you do in between those times?
Well, I think it's very, very important. You see your dentist as often as you need to, and your dentist or your hygienist will be able to tell you how often. Some people need to be seen more often. Home care is critical. You need to maintain your teeth. You have to take responsibility. It's your body. If a physician gives you medication, you have to take it, or it's not gonna help you. So use the tools that are available, and it may not be a standard toothbrush anymore. It may be something more exotic. You have to try and find out what's best for you.
Well, thank you so much for joining us today.
Thank
it was great to meet you.
Thank you, Matt. It was nice meeting you too.
And Dr. Johnson, thank you so much.
Nice to meet you too.
If you'd like more information, you can go to their website at www.smilecreator.net.
Thank you so much.
Thank you.
We'll see you next time.